Oh my gosh, what are you doing here? Oh, now I'm finally dressed. I told you, knock on my door. You might catch me naked. And you did. Well, now we're good. Now I'm all dressed. By the way, it's my buddy Simba. He hates corporate-run healthcare just as much as I do. So he's going to help me explain how we're actually going to pay for Medicare for all versus how we're actually paying for it right now. Alright, and you disappeared on me again. And if it wasn't for the fact that I put slides in the video, I would think you don't like looking at me. Well, the first slide you're seeing there has to do with who actually pays for the current healthcare system we have now. Mostly that's actually individuals in the form of monthly premiums, deductibles, and copays. I don't have to tell you how much you're paying for your insurance right now. If you're paying for it out of your pocket, you already know, and I'm sure it's already more than you want to pay. Something most people don't realize, though, is that taxpayers right now are actually subsidizing much of the insurance premiums that most people are paying in most states. This literally means we are just subsidizing the insurance company's profits. If the government just did the insurance directly, there would be no insurance profits that we would be subsidizing by giving the insurance companies basically tax credits and by giving people tax credits basically to help cover their insurance costs. Also, of course, if you're one of these people where your employer pays your health care, obviously they're paying for your health care for you. But keep in mind, that just means they're paying you less money because they're having to pay for your health care premium. So it's still coming out of your pocket either way. And also, most people don't realize this. Healthcare is actually a state-by-state thing. It is not something that one health insurance company can operate in all 50 states. Each state has its own separate laws. So each insurance company must be its own entity in each state. That means that if you're an employer that operates in all 50 states, you literally have to have 50 different insurance policies, one to cover each employee in each state, which obviously gets very time-consuming and expensive. Oh, I see you're back again. And look, Simba's still here. Like I said, he hates it as much as I do, so he's going to hang out and talk to us. By the way, did you lose weight? Did you get a haircut? You sure are looking good. It could be all that less stress you're probably dealing with thinking about Medicare for all versus what we have right now. And speaking of, these next slides here are going to talk about all about Medicare for all as well. And look, as you can see right there, taxpayers with Medicare for all will be the only ones paying it, and it's just going to be a 2% payroll tax coming directly out of your check. I can guarantee you that your health cost right now, whether employer paid or whether you're paying it, is costing you way more than 2% a year. That's for sure. Now with employers, everything gets much more simpler as well. They don't have to deal with 50 different states and 50 different insurance companies and all the paperwork and the claims and the employees they have to pay. They're literally going to pay a 6% payroll tax, and that's all. So much easier and much cheaper than what they're doing right now. Also, the government is actually going to be able to negotiate with drug companies, with doctors, with hospitals to keep our costs down. That is how we're not going to have constant increases every single year, because when you have one entity who is large enough to negotiate with everybody, quite frankly, if the drug company wants access to the American markets, they're going to pay what we want them to charge, not what they feel like charging, which could be thousands of dollars a month for a life-saving drug. Oh, hey! I am glad to see you survived the last video. Well, I'm going to do a really quick recap here of all the videos. Now, in the first video, we discovered that Medicare for all will be cheaper and easier for almost everyone. 99% of Americans will benefit from it. We also learned that it will be cheaper and easier for employers to manage as well. Next, I showed you how doctors and hospitals will also benefit from Medicare for all. I even showed you how our country will also be better off. Last, I showed you who pays for it and how that benefits everyone. Now, just because I'm done talking about healthcare does not mean you can't learn more. If you look up here or you look up here, you will actually see links to my previous video and my next video. Now, my next video is actually going to be talking about another one of Bernie's positions, which is free public college. So definitely check that video out. And please remember to vote for Bernie Sanders. Stay and watch my next video or get the heck out of my house. You've done already seen me naked. Bye-bye.